Well, good afternoon, everyone. And it is wonderful to see so many friends of Tulane University here today. I want to thank you all for joining us for this very special announcement. This is a momentous day in Tulane's nearly 200-year history. We were founded in 1834 as a medical school committed to tackling the most critical public health challenges of that era. Today, we mark a milestone that catapults us into the future as we confront the most critical public health challenges of this era. Now, great universities have the ability to transform the world, but only if they choose to engage with it. At Tulane, the engagement is enshrined in our motto, not for oneself, but for one's own. As a result, our impact is tremendous, both on the local community and worldwide. From yellow fever and cholera in the 19th century to COVID-19 and cancer in the 21st century. And in order to achieve these life-changing results, great universities drive innovation and research discovery through the support of great philanthropy. And that is why we're here today. I am joined on the stage by the chair of the board of Tulane University, David Mustafer, Provost Robin Foreman, and Dean Thomas Leveist of the School of Public Health and Tropical Medicine. We're here to honor a truly iconic Tulanean, Celia Scott Weatherhead. Celia is a proud Newcomb alumna class of 1965. Along with her late husband, Albert, she has transformed the university with decades of support for our students and our faculty. 30 years ago, the Weatherhead Foundation, represented by Celia and Albert, was inducted into the Paul Tulane Society, an honor reserved for Tulane's most dedicated supporters. That support has only grown in the 3 decades since. Among her many transformative gifts, Celia has established Weatherhead presidential chairs to recruit globally renowned faculty. She's established the Weatherhead Scholars Program, expanding access to Tulane for academically talented students who are committed to public service. We are here today because Celia has just made an historic new gift to the School of Public Health and Tropical Medicine. This gift is the largest single gift in the history of Tulane. Let me I was actually going to say that twice, but but moreover, let me just say it brings her lifetime total giving to more than $160 million for Tulane University. Let me note that's also the largest total lifetime giving in the history of Tulane. Now, this gift will create life-changing opportunities. It will provide more tuition scholarships and fellowships, establish centers for cancer prevention research, the impact of climate change on health, health equity, the use of AI to study population health. It will bring more leading academic experts to the Tulane faculty and create new spaces for discovery. Now, Celia's historic gift comes at a time when Tulane is truly experiencing unprecedented momentum across every metric. Our campuses are transforming with a $1 billion new construction and renovations. Each year, we see the academic caliber of our incoming classes climb. We create more pathways and scholarships to expand access to a Tulane education. and our research enterprise is skyrocketing. President Biden and First Lady Jill Biden visited campus a few weeks ago to announce a major moonshot grant to fund cancer research at Tulane. This brought international recognition and attention to Tulane's powerhouse research program. And in so many ways, this unprecedented momentum has been advanced by the support of Celia and her late husband, Albert, over the years. And with this new gift, Celia is building on a strong foundation that she herself helped lay, and she's now helping us to take us to the next level. Now, Celia understands that the School of Public Health is an important driver of our research ascent, and that its real-world impact stretches from newborns in New Orleans to elders in Argentina. The COVID-19 pandemic was a reminder that our expertise in infectious diseases has never been more critical. Every day, our faculty, students, and alumni are improving health outcomes for communities, both locally and globally. And as the first school of its kind in the United States, the School of Public Health and Tropical Medicine has always been at the vanguard of public health. Celia's gift will establish the School of Public Health as one of the top programs in the world. They will have a monumental real-world impact, improving and saving lives both here in Louisiana and across the globe. Today, with the eyes of the world upon us, I am delighted to announce that the Tulane School of Public Health and Tropical Medicine will henceforth be known as the Celia Scott Weatherhead School of Public Health and Tropical Medicine. So just so you know, this is only the second of Tulane's 10 schools to be named in our history, and it's the first to be named in honor of an alumna of Newcomb College. So let me just say, words, Celia, are insufficient to express our gratitude on behalf of the entire Tulane University community. I want to thank you from the bottom of my heart and everyone else at Tulane. Your generosity will have an incredible positive impact on countless lives, both here in New Orleans and around the globe. So with that, I would like to turn the podium over to the board chair of Tulane University, David Mustafer, to say a few words about Celia's extraordinary contributions to Tulane. David?
Thank you, Mike. This is indeed a historic day, and I hope everyone here recognizes that you were you were here in this very spot when we announced this extraordinary gift. It is such an honor to stand here today as we mark the momentous occasion in the history of Tulane University. Today, we celebrate the naming of the School of Public Health and Tropical Medicine in honor of a distinguished alumna and recognize her profound legacy of service and unwavering dedication to this institution. Celia Scott Weatherhead's commitment to Tulane has always been more than generous. It's been thoughtful, intentional, and deeply rooted in the belief that education and research are the keys to transforming the world. Her service to Tulane over the years, through her invaluable contributions to the board of Tulane, to the President's Council, the Public Health Dean's Advisory Council, and Newcomb Dean's Advisory Council, reflect a deep and ongoing commitment to advancing the mission of this university. In these roles, Celia's worked diligently to help shape the university's strategic direction and ensure that Tulane remains a leader in education, research, and service to the global community. Tulane is a better university, a stronger university, and a more forward-thinking university because of Celia. Her vision and generosity will have impacts that extend far beyond campus. She's helping shape the future of public health, research, and education, and equipping future generations with the tools and knowledge to confront the world's most pressing health challenges. The Celia Scott Weatherhead School of Public Health and Tropical Medicine will be a beacon of innovation, discovery, and service to communities both near and far. Celia, your dedication to Tulane and to public health will leave an indelible mark, not only for our university, but on the world at large. I got goosebumps. I hope you did too. Because of your selfless service and this transformative gift, countless lives will be changed for the better. You've set a powerful example of what it means to give back, to lead with purpose, and to shape a legacy that will inspire others for years to come. On behalf of the board, the entire Tulane community, I'd like to express my sincerest gratitude for your generosity. The world is and will continue to be a better place because of the philanthropy that you've given to this university. Thank you, Celia. And now it's my honor to turn the microphone to Robin Foreman, Provost and Senior Vice President of Academic Affairs.
Thank you, David, Mike, distinguished guests, and of course, Celia. What an exciting day to be a Tulanean. Yeah, one woo, but okay, we should have more woos for that. Because this is also a great day for New Orleans and beyond. It's a great day for anyone who believes that through world-class education and research, we can create a healthier, happier, safer, more resilient, more socially just world. Because that's what we're celebrating today, and that's what this gift is all about. Our School of Public Health and Tropical Medicine, the first school of public health in the country, was founded with the idea that every individual should have the opportunity to live the healthiest life possible. And from the beginning, this school, founded to address health concerns in a major international port city, had a global worldview, along with a deep focus on the health challenges facing our local communities. This landmark gift will provide scholarships for the very best students who want to improve health outcomes for everyone, the brightest minds with a passionate desire to do good, to imagine a healthier future, and to lead change. Celia's gift will also further strengthen our world-class faculty, many of whom are present here today. For those of you, could you please raise your hand if you're on the faculty here? Thank you. Thank you for all of the work and all the contributions you've made to this great school in which we all take so much pride. And this gift will give you the support you need to explore health disparities that strain the fabric of our society and the continuously evolving, both literally and figuratively, threats to public health. It will provide seed funding to support the development of research hubs in areas such as cancer control, climate change and health, health equity, health policy, infectious disease epidemiology, public health workforce development, and applications of artificial intelligence to the study of population health. And with this gift, Celia Weatherhead, one of Tulane's greatest champions, continues her legacy of enhancing the capability, strengthening the reputation, and deepening the real-world impact of our faculty, our students, and our university. So I want to express my deepest gratitude to Celia for her support, her confidence in us, and her transformative generosity. And I want to now introduce the man who will lead this great school into the future. He holds the title of the Weatherhead Presidential Chair in Health Equity, another example of the profound impact of Celia's support and generosity. And he is Dean of the new Celia Scott Weatherhead School of Public Health and Tropical Medicine, Dr. Thomas Leviste.
Thank you. Thank you, Robin. And let's try this again. What an exciting day for Tulane. There you go. Well, obviously they're trainable. Today we gather to recognize a truly transformative gift, to celebrate the impact it will have on our community, and to honor the extraordinary alumna, board member, and friend who is its author. It's been my great honor to serve as steward of the first school of public health established in the United States. We have an incredible history fighting yellow fever and cholera in the 19th and 20th century, helping to define the field of public health and defining the boundaries of the field of tropical medicine. And we were the first school of public health to establish online programs. During the COVID-19 pandemic, we stood at the vanguard of public health, advising government leaders, educating the public, and conducting research that helped to lead to an effective vaccine in the time of global crisis. Today, we move beyond our historic and strengths and our recent achievements. Today, we hit a new inflection point in our school's journey. Today, we take our rightful place among the leading schools of public health. Celia Scott Weatherhead's gift is awe-inspiring because of the magnitude of what it will do. We seek to make the Celia Scott Weatherhead School of Public Health and Tropical Medicine the public health school of the South. The health challenges of the South are the challenges of the nation and of the globe. And there is nowhere more pressing and nowhere with more promise than right here in our own backyard. As we improve the health of our community, as we find solutions to problems that once seemed intractable, we create a blueprint for well-being that will touch countless lives. We will elevate our stature within the field of public health and elevate the value of a Tulane education along with it. We will compete more effectively for leading students and faculty because we will now have the resources to be more competitive. We will enhance our research capacity, investing in new initiatives where our faculty will stand as leaders. We will elevate the educational experience of our students, improving our facilities and extending our scholarship support. We will seize these opportunities to become more active in supporting the public health workforce, particularly in New Orleans and the Gulf South. We will increase our outreach in our community and deepen our impact on public health around the globe. This gift, with its awe-inspiring implications, is all the more meaningful to me because of its author, Celia Scott Weatherhead. And Celia, I know I promised that I would not embarrass you, and I will not. But I do have to say a few words. Celia is a quiet and unassuming person, a delightful person to know. And her dedication to Tulane's progress is absolute. Her belief in the power of Tulane's education is more than gratifying. Her depth of commitment is so profound that it is writing and rewriting our future. Since I first joined this university as a Weatherhead Presidential Chair, I found Celia to be a true champion for Tulane. An incredible alumna, an incredible member of the board, she shares her time, her resources, and her energy, supporting our most ambitious hopes that we can improve the lives of many in our community and around the world. Celia's generosity today also reveals something important about us. It says that our school is worthy of such an investment. And that is because of the many faculty, students, and staff who have been a part of this school community for the last 112 years. And I hope that her gift will inspire other alumni and philanthropists to support the many other worthy efforts all across our entire university. People go into the field of public health because they want to make a difference. Gifts like this allow compassionate, altruistic, and talented people to study and train to make the world a better, healthier, and more equitable place. And I'm so grateful to you, Celia. It is such an honor, and it's so wonderfully fitting that our school will now carry your name. So I end my remarks by reintroducing myself with my new title, Dean of the Tulane University, Celia Scott Weatherhead, School of Public Health and Tropical Medicine. And now I'd like to invite a member of the Dean's Advisory Board, David Edwards, to come up and say a few words on behalf of Celia.
This would be the time that Celia would normally come up here and make remarks herself, but wild horses couldn't drag Celia up here. So I have to make some observations and ask some questions that might reveal some of Celia. I mean, why'd you do this? I mean, you know, Al and you had already made the largest gift to the university in history, and so here you come back again and do this. Maybe it's coincidence, but the very first of the 10 Weatherhead presidential chairs was awarded to this guy in health equity. And I think that ignited the passion that Celia has for public health. And as you pointed out, it is the oldest school of public health in the United States, and we don't want it to stand under anyone else's shadow. We want it to be the top and cast a shadow. So Harvard and Hopkins and Carolina, watch out. Here we come. Yeah, I'd like to close by contesting maybe what Mike said, which is not a good thing to do with the president of the university, but he said that this school was founded 190 years ago as a medical school. Someone else here would contest that and say that it was really established as a school of public health because it was fighting yellow fever. So to think that Tulane University for 190 years has been devoted to that, and to right here in New Orleans, right here in the state of Louisiana, is really just extraordinary. And you know our motto, and Catherine and I are both Latin scholars, non sibi sed suis, and I take a better translation than you, and it means not for myself, but for ourselves. And Celia is making this not for herself, and not even for the people in this room. She's making it for all those people out there in this city, in this state, and ultimately across the world. Congratulations, Celia.
And now I'd like to invite Carol Laverne Burnick, past board chair, and dear friend, Catherine Edwards, please come up on the stage. Catherine, you wanna come?
Sure. Thank you. Not very prepared.
Oh, great.
Celia, would you join us as well? Just
Your hands are cold. Are you nervous?
Sounds like a law firm. Edward Nervous, Louise, and
At this time, it is our honor to present the Tulane University Celia Scott Weatherhead School of Public Health and Tropical Medicine.
time. Two things. First of all, so all of us who work at Tulane University in New Orleans are going to see the name, the Celia Scott Weatherhead School of Public Health and Tropical Medicine everywhere. But Celia may not be here as often as we are, since we're here every day, every minute. So you have an open invitation. But what we did want is to give you a memory so that you can gaze upon it wherever you are. So could everyone please stand? We'll have many opportunities, those of you know, in the next couple days to fet Celia and all that she's done and all that she means to us and the world. And an incredible, incredible person who's touched the lives of so many. But we know at an event like this, it's got to end only one way. And this has got to be a roll wave for the ages, right? In honor of Celia Scott Weatherhead. So this has got to be everyone in the room, a roll wave like we've never heard before. Ready? On one, on three. 1, 2, 3. Roll wave! Please join us outside for a reception.
Someone like you?
Those are great marks, even though you took me to task twice.
I did. Well,
But everyone is happy to take the president.
oh, sure. Oh, easy.
We'll get a few
You're the
more
one-
shots.
Get
Another president resigned.
who